During each visit, your doctor will ask you about your well-being and will also inquire about the fetal movements, any unusual symptoms like bleeding, discharge, or headache. Do inform your doctor if you experience any of these. She will also do a physical assessment, which includes checking your belly size to make sure that the baby is growing. Fetal heart will also be checked, which is around 120 to 160 beats per minute around this time. Your weight gain and blood pressure will be checked to make sure everything is normal. Any edema, swelling around the legs or feet will also be checked. You will be asked to give urine sample. It will be checked for proteins, glucose, and also to rule out any infection. If proteins are found in your urine, further testing will be done to make sure you don't have preeclampsia, that is high blood pressure in pregnancy. If glucose is found in urine, further testing will be done to rule out diabetes in pregnancy. A anomaly scan is usually done around 18 to 21 weeks to know if baby is growing normally or not. The baby's brain, spinal cord, abdomen, bowels, kidneys, limbs, and face are also checked to see if everything has grown appropriately or not. If anything is suspicious, it will be discussed with you and a further plan will be made. If everything is normal, you will be given next routine appointment. Some women are more prone to develop diabetes in pregnancy, but this usually resolves after pregnancy is over. As diabetes in pregnancy is an invitation to many complications, it is always better to detect it at an appropriate gestation. You are considered at high risk if you have family history of diabetes, your BMI is more than 30, you had diabetes in previous pregnancy, you delivered a large baby last time, if you are of Asian origin, and you had a PCOS in the past. GTT, that is test to detect diabetes in pregnancy, which can be done at the start of pregnancy and then repeated at 28 weeks or only done at 28 weeks, depending on the risk factors. You will be instructed not to eat or drink the night before the test. When you arrive, the first blood sample will be taken and then you will be given a glucose drink. Your blood sugar levels will be rechecked after 2 hours. If any of these values are altered, you will be diagnosed as having gestational diabetes. Your doctor might advise you of some dietary changes at first if you are diagnosed with gestational diabetes. You might need some medications at a later date if diabetes is not controlled. You will also be offered screening with blood test if it was not done earlier in your first trimester. This screening is called as quadruple test. The purpose of this test is same as for finding certain genetic conditions like Down syndrome. It is usually offered to those who have missed their first trimester screening test. Ideally, it is done between 15 to 16 weeks but can be done till 20 weeks as well. The blood test will be done to measure beta-HCG levels, unconjugated estriol, alpha-fetoprotein and inhibin A in your blood, and the result will be calculated using these levels and your age. You will be offered cervical length screening if you are at high risk of going in premature labor. Cervix, known as the neck of the womb, is long and closed the whole pregnancy, and it begins to open up during labor. But in few cases, it can open up early in pregnancy and the baby is not mature enough to be born at that stage. This happens due to short length of the cervix. Few women who had previous procedures on the cervix or had a premature labor in the past are at high risk. They are offered cervical length screening, and if their cervix is found shorter than normal, they are offered cervical stitch. This screening is done only in high-risk cases that are increased risk of having premature labor. Anti-D injection. If your blood group is Rh negative, you will need a further blood test to check whether you are exposed to antibodies in your pregnancy or not. This can happen if your baby has a blood group positive. If there are no antibodies, you will be offered anti-D injection to reduce the risk of baby having Rh disease. If the antibodies are detected, you will be closely monitored in your pregnancy.